just wanted to make this video to go a little bit more in depth about the window of relief and the strategy to beat persistent pain. So I talk about the window of relief often, and what this essentially means is, let's say you feel good after a massage or after some sort of adjustment or manipulation, or maybe after a yoga session or some sort of exercise routine. Let's say you feel good. This means you've got a window where you're moving better and feeling better. And if you're dealing with persistent pain, you know that window closes and you'll start to feel tight again, you'll start to feel weaker again, you'll start to feel more uncomfortable again. Pain will either be present or harder to trigger. So anything that's making you move better, feel less pain is opening that window of relief. And again, if you're dealing with persistent pain, you know this tends to open and close and you feel stuck in this cycle. So the way you beat persistent pain, and this is simple but not easy, is you keep that window of relief open long enough for your body to heal, long enough for your body to recover. You need the treatment that you're doing to give you a long enough window to bridge you to your next appointment, or you need to be able to open and maintain that window open on your own. And that's really as simple as it is. If you're going and you're getting worked on, let's say you're getting adjustments, you're getting manipulations or trigger point release from a therapist or some sort of massage, if that is giving you relief, and then by the time you go back to the clinic again, that window is closed and you need them to open that window back up for you, then you are not going to beat persistent pain because you're going to stay stuck in this cycle. And the irony is that people with more persistent pain do worse with hands-on treatments because they start to depend on them. And if you have more persistent pain, that window is going to close faster than you can get back into to have your next session. So people with more persistent pain need more self-reliant strategies. And this is really counterintuitive. And this is why people with persistent pain get stuck in that cycle of going to see a provider, getting worked on, having that effect fade. And it's frustrating because you feel like you're getting better, then you're not, and you're not sure what you're doing wrong, and then you kind of go and try something else and the same thing happens, and you feel like you're just jumping from thing to thing. Is it PT? Is it acupuncture? Is it chiro? Is it massage? And unfortunately, that's just looking at it the wrong way. You can really simplify everything. Anything that's having a positive effect, making you move better and feel better, is simply just putting your body and your nervous system at ease, and then those muscles are going to relax, they're not going to guard, and your body's alarm system and defenses will be lowered, so pain will either not be present or it will be harder to trigger. And all treatments, hands-on treatments, they work in the same way. They all do it like that. You're not getting something super specific done to you. And I know I used to do these things, I used to feel like I was the one making the difference, but really I'm just providing that input to your body to relax it. And you can get that through a multitude of different treatments. That's why so many different specialties exist, because they all work in this same sort of fashion by providing basically providing an input that your body interprets as positive, causing your body to ease and relax and lowering that pain alarm. And again, the problem is when that's not bridging you to your next appointment, so you're not keeping this window open long enough to heal and recover. And so what's the solution? The solution is that you need something that is self-sustaining. You can't take all those things home with you. You need something that you can do on your own that's going to open that window for you and keep it open. And that means you need to find movements or exercises, and not a list of 5 to 10 different things to do and do that once or twice a day. You need to be laser specific, picking the best one or two, and there's a systematic process for doing that. Picking the best one or two based on your body's response. For example, let's say it hurts when you squat. Well, then you do a squat, check in on how you feel, do a set of one of the exercises, do the squat again, and see if it's better, worse, or about the same. And you're looking for your best one or two exercises. Sometimes it may be hidden in the list of things you're doing. Sometimes it's completely outside of that list. And for most people dealing with hip issues, I can probably promise you that 70% or more of you are going to need to do something with the lower back. And that's just based on research. And once you were able to identify this exercise that gives you more immediate relief, makes your body feel better, move better, then you can implement that more regularly throughout the day to keep that window of relief open. And that way you're in control of it. You're not relying on somebody else. You're able to do what gives you that period of relief, and then you're able to do that again before the window closes. And you need to keep that open long enough for your body to heal, long enough for your body to recover. Of course, there's a little bit more to it than that. Understanding what's closing the window is a big one. So if long periods of sitting are closing that window for you, then you need to think about how you can address this. Do you need to get up every hour? Do you need to do your exercise more often? Do you need to invest in a standing desk? Do you need to get posture support? What can you do to make that window not close as fast? And you may also need to consider wellness factors. So those negative physical triggers, like maybe repetitive movements or prolonged positions like sitting that are closing the window, those are going to close the window much faster if your body is in a suboptimal state of wellness. So if you're not getting the right nutrition, if you're not sleeping well, if you're not managing your stress, then something that you can maybe normally tolerate on those days might close the window dramatically faster. So being on top of these things is important to make sure that you're keeping that window open. So it's not just the positive exercises, but it's also making sure that you're addressing and understanding the negatives that are closing the window. And it's really all about optimizing your routine. Everybody's routine is going to be a little bit different, not only in terms of the exercise that gives relief or the movement that gives relief, but how often you have to do it throughout the day, when you have to do it throughout the day. So it's important to learn this process of understanding your body, interpreting those signals, knowing how to check in with your body to know if you should be doing more of something, or maybe you need to work on minimizing some of those negative triggers in a certain way. Really, at the end of the day, are you keeping that window open, which is, are you implementing enough positives? Are you mitigating enough negatives? Are you optimizing your overall wellness? And when you can sustain this window open where you're moving better and feeling better, that's when you add in those exercises that increase strength and stability, because that's going to give your body a stronger sense of resilience, sense of support, sense of safety. So that way, when you go and you're not doing those exercises that give relief anymore, and you're doing more of those things that your body previously interpreted as negative, that window's not going to close. And so that's it. That's the main point for today. Your goal with persistent pain: figure out how you can get that window open on your own, and figure out what you need to do to keep it open. And then build strength, stability, and resilience on top of that. Let me know in the comments what you're doing to help keep your window of relief open, and I'll catch you in the next one.